I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to go over, is your shoulder pain caused by a rotator cuff tear? This is for you if you have shoulder pain, and a lot of people automatically, when they Google shoulder pain, the rotator cuff comes up. So this is a video to go over how you can differentiate what is a cuff tear, what is just shoulder pain. We're going to go through a couple things you can do so you can eliminate some of that pain, and you're able to kind of make a determination. A lot of things that go on with the shoulder are posture related, so we'll cover that as well. As always, like, comment, so we know anything else you want to see or any comments you have on this particular video. So a rotator cuff tear. So it is pronounced rotator cuff. We get a lot of rotary cup, rotator cup. How do you say it? It is rotator cuff, C-U-F-F, and it is comprised of muscles in the shoulder. So it's not just one muscle. There is not it's 4 different muscles, and it is made up of muscles that go on the back of your shoulder. So the biceps, what's in the front of your shoulder, does not make up the rotator cuff. It's really what goes on in the back of your shoulder. And most commonly, it is torn without having a traumatic incident. And what I mean by that is a lot of times a rotator cuff tear just comes on of, I went to pull a key out of the door and I just felt a sharp pain, or I woke up and I had a sharp pain. We're going to go into posture a little bit more later and why that happens, but know that a rotator cuff tear is not something that, you're going to be like, oh, I was lifting 50 pounds and I felt a pop and it was my rotator cuff. Not very common when it comes to rotator cuff tears. These are gradual tears. These are things that happen over time. So it's more of a, I shut the door, I lifted overhand, I just, I felt a really sharp pain, or, you will get that sharp pain feeling a lot of times when you do have that cuff tear, but, don't mistake a cuff tear or having to lift something really heavy or have some sort of traumatic event in order for you to have a tear. So why I said we're going to get back to posture is because it's so important, and a lot of people discount it when you're dealing with the shoulder, and it shouldn't be. What happens is when you have your rotator cuff muscle, or one of them, there is this bone that sits on top of your shoulder, okay? And underneath this bone, there's this little ridge, this little bump, and it goes into one of the muscles of the rotator cuff. So you have this bone here, and then you have this bone here, and then in between these bones, you have a muscle coming out. So what happens is this little bone on top that juts down into the space where a muscle of the rotator cuff goes, it will, over time, start to saw away at that. And what I mean by that is you have this much space in there. When you slouch like this, you sit at your computer, you look at your phone. This space goes from here to here. Well, there's a muscle in between there. So what happens is that muscle starts to get pinched. That muscle starts to get squeezed. And as you move your arm, it acts as a saw. Okay, so it doesn't happen overnight. It doesn't happen in a month, all right? But over time, as you're sitting here and you're reaching overhead, or you're at your computer, this position is actually sawing away part of your rotator cuff, wearing it down. And it becomes frayed. Eventually, that becomes a tear. Now, there's such a thing as a full tear and a partial tear. A partial tear means it's still intact. A full tear means it went all the way through. So a lot of times you're going to have symptoms with just a partial tear. So it doesn't have to be fully torn. The good thing is that most of the time with a partial tear, even sometimes a full tear, physical therapy has been shown to have better results than surgery. Rotator cuff surgery is extremely difficult to recover from. So just a heads up, if you're like, oh no, I just want to go in for the surgery, forget therapy, it's a really hard recovery. I mean, we do get good results from the surgery, but we get even better results when you don't have surgery and we're able to treat it without it. So how do you know what's a rotator cuff, what's shoulder pain, what's going on? You have to understand that a lot of times with rotator cuff injuries, there's more at play. So it's not going to be a straightforward diagnosis of, yep, that's a rotator cuff. There's probably going to be some biceps issues. There's probably going to be some labral issues or some capsule issues in there. So there's a lot at play. A lot of people just want that one specific diagnosis, and that generally in this world never happens. You know, it's very hard to have a specific diagnosis. And if you have pain that just randomly came on, didn't have an accident, didn't have anything traumatic happen, and somebody says, oh yeah, that's that one thing, or you have one diagnosis, they're not right. Okay, 90% of the time there's more at play than just one thing. And unfortunately, we see a lot of people who suffer from this gradual pain that don't get better, you know, and have exhausted all these going other places, and they said, oh no, this person said it was just this, and this person said it was just this. Well, yeah, it was all those things. So you're going to have to attack all those things in order to make it go away. So be aware that a lot of times shoulder pain doesn't fit into this one little pretty diagnosis of, yes, it's a rotator cuff tear. So when you're dealing with a cuff tear and only a cuff tear, what's going to happen is you're going to have what we call a painful arc. So you're going to come up here. It's going to feel fine, fine, fine. Right about here, it's going to hurt, and then it's going to feel better. Okay, that's really one of the best ways to determine whether you have a rotator cuff tear. You have that painful arc, that period of point of pain right about in here, and then all of a sudden it's totally fine and it feels good. Another way to do it is you can point your thumb down towards the ground. Okay, kind of point it into your leg, and then you're going to lift up. All right, so not straight out in front of you, not out to the side. Oh, that actually hurt. But right at a 45-degree angle. Okay, this should feel fine. Okay, if you're like, oh my gosh, that really hurts, there's a problem. Now, again, prior to what I set up before, those two tests test positive for a rotator cuff. However, if there's more at play, let's say you have impingement syndrome, extremely common with shoulder pain, and it's very common to go along with rotator cuff injuries. If you have impingement, a lot of times this is not going to feel good. This is going to be cranky. Does it mean you have a cuff tear? Maybe, maybe not. We do need to make some more determination tests in order to do that. But when you do have a cuff tear, this is going to be like your painful arc area, depending on the muscle of the rotator cuff that is affected. So again, it doesn't, your whole rotator cuff is never really torn. You have one muscle that's being affected as opposed to the others. So that's something to be aware of. So those are the two things that you are able to do at home so you can determine whether you have a rotator cuff tear. So now what happens? Well, if you find that you have pain and you're dealing with shoulder pain, I'm just going to give you a couple things so you can feel better starting tomorrow. The biggest thing is posture, and I talk about this all the time, but we really want to make sure that you have good posture because, again, like we talked about earlier, this is going to pinch off your rotator cuff. This is going to cause impingement syndrome. This is going to cause neck herniations. Okay? And the worst problem is nobody knows how long they're sitting in this posture. So people get stuck here for hours and hours and hours. Not a good thing. Okay? So you really want to make sure you're setting a timer until you're in the habit of getting up. And I really recommend finding something in your everyday life that forces you to get up. So maybe the phone rings every 15 minutes. Here, we see patients, all the time. So when we're at our desk, it's for 10 or 15 minutes at most before we're treating somebody or need to be doing something. So if I'm sitting down, that's the maximum. So I don't have to set alarms on my computer to stand up. You need to find something in your day that makes you stand up on a regular basis. Maybe the phone rings off the hook at your office. So every phone call, you just stand up to answer it. Setting an alarm for every 15 minutes to stand up is a great way to get yourself into the habit, but unless you associate that habit with something that you already do and you form it into a habit, the minute that timer goes off, chances are you're not going to stand up. So you really want to tie it to something that, you are able to, kind of form with a memory, associate the phone ringing with standing up. I know it's like a Pavlovian dog, but it's really true. The more you can incorporate things into your everyday life as opposed to this being an inconvenience where every 15 minutes I have to roll my shoulders up and drop them down. Every 15 minutes, oh, now the phone rang. I know I just have to roll my shoulders up, back, and drop them down. So that is the exercise because you want to get out of this posture. And you don't want to overcorrect, so you want to go up, back, and drop them down, nice and easy. So you're in that posture. I don't care if you have shoulder pain or not. I don't care if you have a rotator cuff or not, tear or not. Anytime you're working out, you're doing anything, you need to make sure that your shoulders are in this position. Going to the gym and lifting weights and you're in this position, you're really causing a lot of pain and a lot of issues to your shoulder. So you want to make sure that whatever you do, whether you're suffering from shoulder pain or not, you roll your shoulders up, back, and drop them down. This is the starting position for anything to do with the shoulder, for anything to do with the neck, all right? It's not here. We're not plastering our shoulders back, okay? But we are rolling them up, back, and dropping them down. So what else you can do is what you, a lot of times with rotator cuff injuries, shoulder pain, when you raise your shoulder, you're going to notice it goes like this, okay? This is not a normal, healthy shoulder motion, okay? So what you want to do is you want to check yourself out in the mirror and you want to watch yourself raise your arm. And this is it. And you want to do this nice and easy about 30 times. You want to make sure your thumb is facing up, and you can do this straight in front of you, okay? And you can do this straight out to the side. All right, now if this is a painful arc, you are going to need to get it treated, because this is what's going to happen as you go through that arc. You're going to raise your shoulder. You're causing yourself neck pain. You're causing yourself more shoulder pain. But if it is just more of an impingement issue, and you're not really going to get that pain going through that arc, you just want to raise it up nice and slow, nice and easy. Do about 30 repetitions. You want to retrain your muscles like this, okay? This is not going to happen overnight. And if you do it once and you're like, yep, got it, okay? That's okay and that's great, but it's going to take about 6 weeks for you to be able to lift your shoulder or lift your arm up correctly, nice and easy, so that you're able to lift it without doing this or moving any part of your body. It's really important that you look in the mirror when you're doing this. You look at a reflective surface, because as you get tired and as you get near 30, you're going to start to raise your arm. And even though it's a very simple motion and you're like, okay, this is really stupid, it's really important to do so, because when you, again, if you don't retrain your muscles, you're going to start to do this, and you're going to retrain them to do this. The last exercise that you're going to do with any type of shoulder pain, you're going to start with your shoulders roll up, back, drop them down, okay? And then all you're going to do is you're going to squeeze them back and down, okay? So it's what I said is overcorrecting, all right? This is actually an exercise. So you just want to squeeze them back and push them down. Squeeze them back, push them down, all right? The point you don't want to miss is where you push them down. Again, because so many people who have shoulder pain tend to be up and elevated like this. This is going to pull them down, okay? So it's back and down, back and down. You can hold that for 30 seconds. You can hold that for 3 seconds and do about 30 of those. If you're really good at it, you can do a band, all right? Where you just hold a band in front of you. That's fine too, all right? Just nice and easy. The idea is that you're squeezing your shoulder blades together and you're pushing them down.